SELSI, spoken easy language for social inclusion.
So we're really delighted to be here. Thank you so much for inviting us. There's so many friends here that we know from the Easy Language International Network, and we're making new friends. It's just amazing. Thank you for Tatiana for making this possible. We'd like to give a little warning before we start. We are going to be mentioning the topic of violence against women. It's not going to be something we're going to go into in a lot of detail, but we will be talking about services that work with women who have experienced sexual violence. So I just wanted to let people know before we start. So our presentation, we worked on it together, and we thought, there may be some key points that we wanted to focus on. One is thinking about the link between presenting accessible language and accessible communication, and having whole systems of support that are accessible, and how those two things connect. We wanted to bring in some findings from research that have got the ability to change practice, the way that things go in everyday life in different services. But we also wanted to think about the challenges of doing things in new ways, creating like a new normal. Even when you've got some really helpful findings and good new understandings, how do you make that part of a new way of doing things? So I think that was some of the themes that we're going to talk about. So Katy and I know each other. We've worked together for a few years, but I'm mainly a researcher. I've done research into easy read written texts, and I do conversation analysis research, looking at spoken language with people with intellectual disabilities. Katy is a researcher and also a translator, an easy read translator. So we wanted to give you a bit of a picture of our work, kind of a bit more of our everyday work, working with different ways of trying to bring easy language into services and create a new normal. So a little bit of background. Do people even know England exists anymore? Now we've lost it's just sad, isn't it? So yeah, there's this little island off Europe, off the coast of Europe, off the coast of France. Where we just do our own thing these days and, whatever. Anyhow, we have got, I think there is a reason, actually. Easy read, in particular, is a really big thing in England and the UK. And probably more than in other European language countries, I think. It might be because of our laws. So two important acts. One is the Equality Act, which is our Equal Opportunities Act, which says that any organisation that provides a service, like a bank or a hospital or whatever, social work department, if they're working with someone who is disabled, they have to make what we call reasonable adjustments so that the disabled person can get a good service like everybody else. Otherwise, they're doing discrimination. So this is in law, in English law, UK law. No, English law. There's different acts in the other countries in the UK. And we also have something called the NHS Accessible Information Standard, that says that health and social care providers have to help people with communication support needs so that they can get a good service. And they have to assess people for their communication support. They have to share that information, and they have to meet their needs for communication support. So these are in law, both of these important bits, directions. I think maybe a bit of a difference is that, we can talk very interesting about the history of services for people with intellectual disabilities. But we have a very well-developed community network of specialist teams and services for people with intellectual disabilities. I've worked in a few of those teams. They're usually got a mixture of different specialist health workers and social workers, and every single local authority, usually that would mean about 200,000 people, will have its own community intellectual disability team. So we have quite a good network of specialist health and social care workers, which is maybe a bit unusual compared to other European countries. I don't want to take too much on the background. So I'm going to talk a little bit about, we're going to focus on mental health. I can't quite remember why we decided to, but anyhow. And thinking about mental health challenges that people with intellectual disabilities have. We know that mental health is a really big issue in the lives of people with intellectual disabilities. And there's really good reasons for that. You know, life is hard for many people with intellectual disabilities. It's hard to get a job. It's hard to get good support. There's a lot of kind of bullying, discrimination, and it's hard to get good health and social care services. So some people say that you're maybe 4 times more likely to experience problems with your mental health if you have an intellectual disability or autism. It really is a big issue. And I think part of this is because services are not really making these reasonable adjustments that they should be making in law. And I think there's a particular issue. I'm a psychologist, so I'm interested in how people get into psychology support. We call it talking therapies in English. So like talking to a counsellor or a therapist or a psychologist, which is quite a good way to help people with their mental health problems. You can also take mental health medicines, but these have all kinds of side effects. Hopefully talking therapy doesn't have the same sort of threats to your physical health as well. We have a large service, again, I think this is quite unique in England, called, I'm going to use the word IAPT, because that's how it's spelt out. It means improving access to psychological therapies. It's been going for quite a long time now, and it was set up by the Labour government, new Labour government, and the goal of the programme is that everybody should be able to get help from a therapist or counsellor if they're feeling low or worried. And it shouldn't be difficult, and people should be able to just refer themselves, put themselves forward, and they should be seen kind of quickly and get good talking therapy. It's really huge. So I understand the population of Slovenia is around 2 million, is that right? So 1.5 million people are referred every year to this service, every year. That's a lot. It's a really big service. And they should be helping everybody, including people with intellectual disabilities. But when the service was just beginning to get started, we tried to find out how many people with intellectual disabilities were being seen by the service, and it was only quite a small number. It was definitely less than the people we imagine are out there, about half, less than half. So I think people were finding all sorts of barriers to getting hold of good mental health care. For the individual patient, they might find it hard. I think this is something that came up in the SELSI survey, actually. They might find it hard to put their feelings into words and kind of explain in words how they're feeling. It's quite complicated. It's hard for anyone to do, to be honest. But maybe that's particularly hard for people with intellectual disabilities. We know that the people who are working in this big service were not making good changes to their written information or the way that they were talking to people. And when we did some surveys, what we found is that people with intellectual disabilities were maybe just going along to one meeting and then deciding not to go back again. because it just didn't feel the right sort of service for them. So they were losing out, they were missing out on the benefits of a talking therapy. And we did see quite a lot of barriers at the systems level. So when we talked to the bosses, sometimes they would say things like, we don't think our service is the right one for people with intellectual disabilities, because people with intellectual disabilities haven't got the thinking power I don't know, to use a talking therapy. You know, very negative views. So I'm just going to say a little bit about the work that's gone on. And it's not just myself. It's been pushed forward by people like me who work in the NHS as a practitioner, but also by people who are doing research. When we did, just following on from the stuff that I did with some colleagues around 2015, a few of us made this positive practice guide for the people providing psychological therapies. And it's got lots of advice about identifying people and different ways of working with them, making adaptations to how you speak and how you write things down. Lots of kind of tips and resources. And the other thing that people found really helpful, we had these little case studies where we gave examples of services that had managed to do things differently to kind of inspire people, give them some ideas. We had some big studies that were research studies that were funded by the Health Service, where they tried out some new ways of delivering talking therapies. And the people who made the research also made some really nice resources that are now available for free. We developed some training for the people who work delivering psychological therapies. And where I work, we set up we meet every month actually. Myself as a specialist learning disability psychologist, I meet with the other therapists in the IAP service. And if they've got any tricky issues they want to discuss, you know, I can give them some support about how they can adapt their work. So overall, it's been quite promising, really. And the rate of people being referred, people with intellectual disabilities, has gone up quite a lot. So it's closer to what we'd expect from how many people might be out there in the general population. So I think what I'm trying to say is that, you know, it's bringing together changes at lots of different levels, both research and practice, not just accessible language, but thinking about accessible systems. So definitely we need to support individual practitioners who are working in these kind of what we call ordinary or mainstream services. They need to learn more new skills. They need to build up their confidence. If I meet someone with intellectual disabilities for the first time, I don't know the best way to communicate with them. It will take me a bit of time, but I just have to be confident that we'll get there in the end. So just building up people's confidence, building up their skills. But that's not enough. You really have to have accessible systems where at the level of the people who are running the services, they really want to support change. And they believe that they have, that they need to do it. They haven't got a choice. They have to have values about being inclusive. And those of us who have special skills, because we've worked with people with intellectual disabilities for a long time, we have to share those skills with people who maybe are just beginning to learn how to work with this group. I hope I haven't taken up too much of Katy's time, but I'm going to hand over to her next.
Great, so I'm just going to talk about Easy Read in the UK generally, and then just go through a bit of a case study about one of the translations I've done recently, and I'm actually in the middle of, so any tips are welcome. Sorry, thank you. So in the UK, there's lots of different groups of people who do Easy Read. So there's small businesses and individual freelancers like me. There are also accessible information agencies, so people who might make broader accessible information, like large print and braille, also do easy read, but also specialist organisations. There's learning disability support organisations and charities. And, oh, am I very quiet? Sorry. Thank you. Is that on? Is that better? Sorry. Got a quiet voice anyway. Yeah, so there's lots of different groups, and I think my point really is that that each of these groups have different specialisms, different knowledge. So there's a lot of knowledge in the language organisations, but also within the user groups, within the health, and then also within the government departments who are also doing it. So they have knowledge about sort of regulations and laws. And I think it's important that we all sort of pool our resources and knowledge and work together to make the information that's needed instead of working in little separate groups. I think that's really important. This is just a bit about me. So I'm a full-time Easy Read translator. I think Deborah has already explained this. So today I'm going to talk about a project for a women's organisation. It was for a rape crisis centre. So they got in contact with me through my website and said that they wanted to make their information into easy read format. And it is quite a lot of different information. So it's first of all the welcome pack, but then also a self-referral form, so people could fill it in on their own and then send it off and get the support from the organisation. And then some other sort of institutional documents that they needed to fill in and do. So it was quite a complex thing. And I suppose it's quite a difficult project for me because I haven't really worked on that area before, and I don't have a background like Deborah in this sort of counselling area. And so one of the main outcomes of filling in the form would be that the individual gets the support they need after having been attacked. So there's lots of different types of support they could get. So it's about sort of making sure they could get the right one, whether it's counselling, support going to the police, or a kind of a legal advisor, and some other sort of groups and things like that. So it's quite challenging, this kind of document for us, because first of all, we have to think about what the risks are of our translation. So like, what's the worst thing that could happen because of how we've done it. So first of all, we could be put people off of getting the support that they really need after such an awful experience, or we could upset them in the process. And it's also sort of a challenge within this is that we share the responsibility of who makes sure that person is informed. So we share that responsibility as the translators, but with the advisor in the setting. So neither of us should be making assumptions about who's told the individual the information. So we want to make sure that everything is covered. And I think that's quite a useful point to sort of think about easy read translation as taking place in a social situation and making sure we remember that, rather than a translation just being an isolated a document on its own. Like, it's always going to be given by somebody, so there's going to be a relationship there, or there's going to be an environment, a setting in how it's used. So we just always have these different steps to our translation process. So we have a discovery step where we try and find out from our client who's going to use the document, so who's it for, and which staff are going to use it if they do, what areas they're going to focus on, when is it going to be used, where, why. So I say we try to find this out, but we don't always get it, so it's always quite hard, and quite often we don't really have much knowledge of the context. We also try to find out the sort of deadlines, any important words within the document that they're likely to come across in an interaction with the staff when they meet later. So anything that's spoken, that's also written. We make sure that we keep that in there and explain it if we need to. We talk about images. So I've just learnt something today, though, about the photos. So that was really helpful. So I'm going to be going back to my work now and putting all the photos back in and taking out the drawings. And yeah, so we look at all that and the branding as well, which I think was really important with this project, because I think it's super important for people to be able to trust the organisation that they go to with this kind of for this kind of support, and trust is really, it's I don't know, it's really communicated through documents, and I think we really wanted to make it quite professional if possible, to kind of equal the original, because we had quite a significant brand and it's quite established. So we wanted to match that, and we didn't want the Easy Read to be like a lesser document and less trusted. Okay. So then we also have the design step, which we structure the document, we draft the text and the images, and we do several rounds of edits, and then we test it with the users. And then finally the delivery, and then there's also a support step. So I really try to sort of stay in touch with our clients to listen to any feedback from their users. So did it help? Like, what impact did it have, if anything? You know, was it positive or negative? And how can we change our processes to make it better next time? Or, you know, what can we learn and what can we share? So I think the main thing that we did here to the form, so you can see like a little bit of the form here. It's really intense. There's a lot going on in there. It was very long. I think it was about, 20 pages long. And we were talking about it yesterday, and we were saying that, neither of us would want to fill this in after having such an awful experience, and definitely not on our own. So we were trying to think about how it would work and what really needs to happen there. So I think probably the main thing that we did with this was to really cut back all these institutional terms that are used to describe what happened, and sort of take the work back away from the user. So instead of asking them to do all the explaining and the thinking, we sort of just get the very basic information so they can get in touch with the counsellor or the organisation, and then are able to explain in a setting where perhaps it's better suited to them, or they have the support that they need. However, there's a lot of information here that's so lots of different ways of describing. Oh, am I all right time-wise? Sorry. Okay, I shall speed up. There's a lot of information, but instead of sort of cutting it and getting rid of it, what we did was we put it into a separate document, so it's there for the staff to use should they need it when they have a consultation with the user. So they might need it for the sort of spoken interaction, because we feel that it's good to take the information out, but if it's of course essential to the interaction to the service, then we sort of support the staff in other ways, so they can then be able to refer to the same issues in the same language, so in a consistent manner as well. And I quite like this quote from NHS Design. Okay, so there's some other things that we did. So we cut out all the non-urgent parts, we put them in separate documents so they could be referred to at different points at the right time when it was right for that person. We did different levels of Easy Read, phone numbers, suggested some extra specialist support organisations, and we insisted on expert review and user testing. And I just wanted to list here some really good places that we go for support. So in the UK, there's an organisation called Easy Health, organised by Generate, I think, isn't it? We've got the NHS Design Principles. We've got now 5 clear language networks, which is amazing. From nothing to 5, all different specialisms. It's really good. And there's an Easy Read Facebook group, and then we also have our usual user group and some online testers. And there's also a patient information forum in the UK, which is brilliant, and they set guidance on how to communicate patient information, but actually there's not so much of a focus on Easy Read, so that might be an area to explore with them. Okay, so that's pretty much everything I wanted to say. Just wanted to really focus on Easy Read being part of the process, so more as a system. As Deborah was saying, I'm thinking about the kind of culture and the environment, and the spoken advice that goes with it, and how we can support staff to share the information, but both in written form and in verbal communication. Yeah, I think that's it.
SELSI, spoken easy language for social inclusion. Partners are Zavod Risa, RTV Slovenija, Dyslexieverbundet, Università degli Studi di Pavia, Vieglas Valodas Agentura, Vilnius Universitetas, Vsi informacijos kaupimo ir sklaidos centras. Funded by the European Union.